people have lot of doubts if certain tests are necessary before surgery. So for any major surgery, basically we get a surgical profile done which includes all the basic tests, including complete blood picture, liver functions, kidney functions, and viral screening, blood grouping, clotting time, bleeding time, X-ray, ECG, etc. These are all basic things which are only done to evaluate the condition of the patient. And in case we find any abnormality in the X-ray or ECG, we may ask for extra tests such as 2D echo or TMT based on the condition of the patient. See, what we have to understand here is surgery is being done to the patient, and whenever it is a very, all these tests are done to make surgery safe for the patient. So unless the surgeon is sure that you are safe for the surgery, he would not recommend you for a surgery. And see, in elderly patients with multiple lung function compromise or cardiac compromise, in these patients, when we take for laparoscopy, there is going to be a problem, because when we fill in the abdomen with carbon dioxide, there is going to be a back pressure on the heart and lung. So we need to evaluate these patients whether they will be able to tolerate anesthesia or not. So anesthesia definitely has an impact on lung and heart. So once you are sure that you are fit for laparoscopy, you will see your procedure may be done within half an hour. So in order to make you fit for laparoscopy, we may sometimes have to get these tests done, and after these tests, if the anesthesia person feels that you are fit for the procedure, then only we will plan the procedure. Or sometimes patients may be taken under high risk. And see, another problem with people, usually what they find is, what if we sign the consent and what if we land in problem later? See, consent is only for the protection of the doctor and hospital, and it is to explain, it is a proof that we have explained everything about the problem, and we have made you aware of all the possible complications that you may land up after the procedure. That doesn't mean the patient will definitely land up in procedure. See, any patient undergoing general anesthesia, from the last 20 years, we tell there may be a need of ventilator, but till date nobody actually needed a ventilator after a normal elective general anesthesia. So see, doctors and hospital people want to be safe on their side, as well as they want to educate the patient as well. So don't be afraid when somebody tells you that you may be needing a ventilator, you may be needing higher antibiotic post surgery, or need of a dialysis machine. See, these are all the care that we take in educating you. Nobody wants you to land up in problems. We want you to get out of the hospital as soon as possible. But then everything is evidence based nowadays. Now everybody will come and ask the doctor, have you informed the patients about the complications? That is the reason we keep everything documented. So don't be scared of the consent. Once you know your surgeon properly, once you trust the surgeon properly, once you are aware of your problem, get educated, try to learn all the complications that can rise, and you try to correct whatever lifestyle you are having, as well as follow the instructions given by the surgeon. They will definitely help you recover fast and get out of the hospital as soon as possible. Fear is the most common thing that I keep seeing in my daily surgical practice. As a consultant surgeon from the last 20 years, I've been seeing variety of patients, and the most common thing that I see in all of them is fear. What will happen to me after I get the surgery done? This fear or anxiety plays a major role in the recovery of the patient. See, what we have to understand, as I have been seeing over the last 20 years, that a patient who is very calm and composed has a very good recovery time. Like what I mean to say is, patients recover in a day or two. But the one who is stressed will take at least 10 to 15 days to recover, and actually he may develop complications as well. So I would advise everybody that whichever surgeon you are visiting, try to write down all your queries. Try to understand what surgical problem you have, and try to understand if surgery is the only option, or do you have any medical treatment for that problem as well. And try to improve your awareness about the problem. See, awareness plays a major role. And second thing is your comfort with your surgeon. That plays a major role too. When you meet your surgeon once or twice before going to the surgical theatre, that will have a major impact on you. See, the presence of surgeons in the operation theatre itself can calm the patient a lot. So, people usually keep telling me after surgery my life has changed. See, you have to understand one thing. Surgery was done 20 years back and yet it has such major impact on that person's life. Imagine what they are going through. See, you will have to build up your awareness. See, surgery is to help you come out of a problem. Problem is already there. Surgery is helping you come out of the problem. So when you understand this, that surgery is going to help you, your thought process will definitely change, and then you will start thinking in a new way. See, the burden that I've been carrying since the last several years is going to be over now. I don't have to carry this burden after my surgery is done. My life is going to improve after the surgery. When you think in this positive way, automatically fear will be gone and you will be more composed and peaceful, and you will also recover faster. See, I keep seeing a lot of people asking me about anesthesia and complications. See, people tell me, sir, I got operated 20 years back and since then I've developed back pain. See, spinal anesthesia and back pain, there are several studies which show that they are not related at all. See, what happens is people are developing a lot of micronutritional deficiencies, and dehydration also plays a vital role in the shape of the disc, and their position also plays a major role in the disc bulges and all. So see, they are attributing everything to the surgery because surgery has become such a big thing in their life. People talk about before surgery and after surgery. See, you have to understand, surgery is something which is done to bring you out of a problem, and when prepared properly preoperatively, and when you are given proper awareness, when you are clarifying all your doubts with the surgeon, your process will become very easy. So get all your doubts cleared, increase your awareness, choose a wise surgeon who is actually well experienced and having a helping nature, so he can try to help you out and get you on your feet as soon as possible. So people keep asking me, is a open surgery better, or is a laparoscopy better, or laser surgery better, or a robotic better? See, I tell you, the surgeon who is treating you is the first and most single important thing in your recovery. Let your surgeon decide what is correct for you. For some people who are not fit for laparoscopy, open may be better. For some people for whom laparoscopy and open, you are not fit for general as well as spinal anesthesia, for them regional block may be better. See, I keep seeing a lot of diabetic foot patients with gangrene and all, wherein they are not fit for general as well as spinal anesthesia. We will have to operate under ankle block or regional block. See, it depends on the patient. Your surgeon is the single most important thing. The experience of your surgeon, the success rate of your surgeon plays a major role in the recovery of the patient. So whatever is correct for you, let your surgeon choose for you. So when I was a child, I used to see patients admitted into the hospitals for 30 days at least. And on all these 30 days, they were not asked to move around. They were supposed to lie down in the bed, and eating also whatever bland rice that they used to give. Only patients were supposed to eat that. And daily dressing used to be done, no bath for 30 days. I used to find it very pathetic. And when I started my practice 20 years back, based on all the research articles that I have read, I have started practicing what is supposed to be good quality surgery. Okay, so we educate our patients beforehand. So my patients walk on the same day of surgery. They climb steps, they climb up and down. They start consuming water 6 hours after surgery. In particular, in some cases, maybe a day later or 2 days later, depending on the surgery that I do. But normally people start sips of water on the day of surgery, evening after recovery from the anesthesia. And once they are tolerating fluids, I start them on soft diet as soon as possible, and patient will come back to normal diet by the next day morning. And I discharge patients as soon as possible, maybe on the same day evening or on the next day morning. And what we have seen all these years, in this last 20 years, is you have to wash your wound properly. Washing it is not a wrong thing, but you will have to keep it dry. And we will teach our patients how to take care of their wounds. And in the last 20 years there have been no complications, absolutely. Patients, early ambulation, early enteral feeding, these are all the things that are helping patients get back to normal life. The quality of surgery, the quality of surgeon is only known by the result that the patient experiences post surgery. So if the patient comes back to normal life as soon as possible, that means he underwent a very good surgery. Also, people have many doubts regarding the food that they have to consume after the surgery. See, I keep seeing a lot of patients and they keep asking me one thing. See, if I take a lot of dal or pulses, will I develop infection? See, we have to understand one thing. Dal and infection are nowhere related. Research studies show that actually taking pulses will help in wound healing because they are rich in protein, right? But then we give some value to the belief that the patient has. See, if the patient very strongly believes that eating this dal will definitely land me in problem, then we will ask that patient to avoid eating that dal and we will ask him to eat all the other pulses. And few people say eating non-vegetarian after surgery is actually healthy. See, I would suggest you, see, during surgery we give antibiotics for at least 5 days post surgery, and during this time there is a chance that acidity increases, so we also put them on antacids. But the thing is, when you are eating a lot of non-vegetarian, that is hard to digest foods or some new type of food or some spicy or outside food, junk food which is hard to digest, and fried items, they actually increase your acidity. So we would recommend our patients to eat foods that are easily digestible and which they have been eating since childhood, and that too very soft diet, and that too in proper time, and small feeds more number of times with proper time for a meal. So this is what is going to help them. When GI system load comes down, body will try to repair the wounds even faster. So try to eat healthy, and if you have any concerns about your food, ask your surgeon, they will clarify it for you. And nowadays non-vegetarian is loaded with steroids. That is also one reason why I ask my patients not to consume non-veg for at least some time after the surgery, because steroids not only have an impact on your sugar levels, glycemic variability also increases. At the same time, your immunity also will be affected, wherein chances of infection can increase. So have healthy food, which is basically home food, cooked food, very soft food with proper time. Try to chew it properly and eat it. Consume lot of water. See that your sleep is very nice after the surgery, and don't panic. These things will help you recover faster.
రోజు 3 అద్భుతమైన ఆరోగ్య వీడియోల కోసం 3TV హెల్త్ ఛానల్ ని లైక్ చేయండి, కామెంట్ చేయండి, సబ్స్క్రైబ్ చేయండి, అలాగే షేర్ చేయండి. థాంక్యూ.